Hi, this is Brian Kim. I'm going to share with you case number 130 in the best way to do cataract surgery series. This is a patient who has a pretty large pupil and somewhat of a soft lens, and you're going to see my attempt to perform hydrodelineation. In this case, you get this beautiful golden ring. So the golden ring sign is when you place the hydrodissection cannula within the meat of the epinucleus, and this creates a nice, beautiful dissection plane between the epinucleus and the endonucleus. And so this is actually a beautiful thing because you can use that as your landmark to where you need to place your chopper for the chopping maneuver. So I'm using the cotton tip to steady the eye and then using a corneal marker which will help me to center and size the rhexis. Turning the eye with a cotton tip and then making my incision with the diamond blade, making sure I'm flat to the iris plane, first on the right side and then the left side. And I'm using the cotton tip always to turn the eye so I can get a better corneal shelf, which will allow me to achieve a self-sealing incision. So this is some intracameral lidocaine, and then some intracameral epinephrine, and then some dispersive viscoelastic to coat the corneal endothelium and flatten the anterior capsule. This is a triplanar corneal incision. I make a vertical groove, place the blade into the deep part of the groove, tunnel through the cornea, turn the eye towards me with the cannula, and then I enter. You have a really well-controlled, well-constructed triplanar corneal incision. Push some more viscoelastic in and try to make that extra viscoelastic about the size of the rhexis. And again, this is an older video, and so you'll see the Utrata-style forceps I use here. Puncture the center, grabbing the right side of the tear to create a flap, going around circumferentially, having to pull a little bit inward to keep the rhexis the right size and shape. I'm having to pull inward a little bit to help the rhexis maintain the same size and shape. This is the Capsulorhexis hydrodissection technique. I place a cannula under the rhexis edge contra-incisionally. I'm pushing and you get a nice hydrodissection wave. Decompress on the left side, and this is a hydrodelineation wave. Stabbing it into the meat of the epinuclear material, spinning the lens now, hooking it on the right side, and you can see this beautiful golden ring. And so that's the golden ring, the dissection plane between the epi and endonucleus, and the light reflex is shining through in that interface and is creating this beautiful ring of light. Go in with the phaco tip and removing the central epinucleus. Again, I'm going to place the chopper at that level. I don't really have to go further than that, but you have to go at least to that part at the equator. So this is in half speed. I'm placing the chopper under the rhexis edge. You can see I'm rotating my wrist. It's a pronation movement. And then once I get under the rhexis edge, I rotate it pointing straight up and down. I place the phaco tip vertically subincisionally, bring the instruments together, and it fractures it in half. I place the chopper under the right heminucleus, again, to the level of the golden ring, point the tip down so it's vertical, pull it towards the phaco tip centrally, and it fractures and bisects the right heminucleus. I'm going to use some vacuum to grab that first quadrant, which comes out very easily because it's fractured very cleanly. And then I start to emulsify the lens piece. You can see the epinucleus is perfectly intact. That means all the action was within that epi-endonuclear interface. Anyone who's scared of this technique saying, oh, you're going to break the bag, you're going to hit the capsule, I am nowhere near the capsule when I do the maneuvers. The epinucleus being completely intact tells me I was nowhere at the level of the epinucleus and more peripheral. So epinucleus to the cortex to the capsule, I was nowhere near there. I was just at the epi and endonuclear interface during the chop maneuvers. Using the chopper to free that small fragment up and then emulsify the lens piece. And then go ahead and spin the second heminucleus in front of me using the chopper. So again, you can, the golden ring is not there, but you can see the outline of where I'm trying to go. So I pronate my wrist, place the chopper under the rhexis edge, pulling the lens piece towards me and fracturing against the phaco tip. You see that the lens just began to fall apart, and you saw how it kind of came out of the capsular bag, the very clear demarcation line and separation of the endonucleus from the epinucleus. You can see the epinucleus is completely intact. Again, all the manipulation is really more central than you think. So I'm not near the posterior capsule, and it's a very, very safe maneuver. Go ahead and use the phaco tip to remove the epinucleus from anterior to posterior, which comes out nice and easily here. So I take the chopper out, push BSS in, take the phaco tip out, and I go in with the INA handpiece. This is a fairly clean bag, so I switch to polish mode early. I'm polishing under the rhexis edge. There's some subincisional cortical material there. Pulse some BSS into the subincisional capsulorhexis. You can see some material starting to come up. This is some cohesive viscoelastic to fill the bag. So you can see this is the capsule sweep, but this is the old version. So this is the older case that I'm showing you. Polishing underneath the rhexis edge on the left side and then the right side. This is a single piece of acrylic lens. It's going to go into the capsular bag. At least the leading edge is going to go into the bag. Quickly transition to the INA handpiece. Go in with irrigation off. Activate irrigation, making sure both haptics come off the optic and go into the bag. Tilting the optic, going under it, rotating at 90 degrees clockwise, removing the viscoelastic from within the bag. Popping the lens back into the bag, polishing under the rhexis edge. Polishing underneath the lens again, removing all the viscoelastic from the anterior chamber, and then I'll hydrate my incision. So again, this is a softer lens, a really big pupil, so you're able to see very clearly the chopping motions for double chop, cross chop. And again, the chop maneuver is not going all the way out to the posterior capsule, so you're not going to accidentally rip the posterior capsule or damage the posterior capsule. The key is, for anyone who's learning, is to make sure you're definitely inside the bag. So when you place the chopper out, depending on however you do it, you want to make sure you push down into the epinuclear substance and you're gliding out to make sure that you're definitely underneath the rhexis edge as you go out to the equator. Once you get out to the equator, you only have to get to the epinuclear, endonuclear interface. And so the golden ring sign and doing hydrodelineation does really give you a very clear visual cue, and that's all you have to get to. You don't have to go more peripheral if you're nervous and learning. You just have to place a chopper to that epi and endonuclear interface, and then you just chop the endonucleus. You're able to keep the epinucleus intact, which I really enjoy too, because by having the epinucleus there, it creates a nice buffer and it keeps the posterior capsule back. And so that's why I like keeping the epinucleus intact. Once the endonucleus is all gone, you can very easily remove the epinucleus either with the phaco tip or IA and then finish the case. And so this is utilizing hydrodelineation to get the golden ring sign and being able to find where to place your chopper for chop techniques. So I hope this was helpful to you, and I thank you for your attention.